The commonest way we approach any individual who presents to us is by first trying to understand what he is actually suffering from, whether it is a situational reaction, which probably counseling can help, or whether it is a pervasive thing and it is a disorder. If it is a disorder, then we try and identify which disorder it is, like whether it is depression, in depression, whether it is a simple depression, whether it is a major depression, whether it is bipolar depression or anxiety disorders. Once the diagnosis is made, then it would depend on the severity and the effect these problems are having in his personal professional life. If the symptoms are very mild and it is not significantly impacting his personal or social or professional life, then we usually would like to treat with counseling. If the symptoms are severe enough and they are affecting the other spheres, then we usually would like to prefer prescribing medicines. Many a times people have multiple myths or false beliefs about the medicines that a psychiatrist gives. That is, these medicines would give rise to dependence, they make you drowsy, they make you dull. But it is not the scenario. It is these medicines are to be taken like you would take treatment for diabetes or for hypertension or blood pressures. Just like the medicines help control your blood sugar or your uh, blood pressures, similarly, here they help get into control the symptoms that you are suffering from. After the symptoms are under control, you are in a proper frame of mind. Then we start on counseling. Now, counseling itself has multiple modalities. Commonest that people usually will ask is about CBT, a term which everybody has been aware of. But apart from CBT, what usually we employ in a clinical practice is something called as eclectic therapies. That is a combination of multiple modalities of therapies so as to suit the need of the patient and give him a relief in the fastest possible time. So we have the various modalities are CBT, REBT, exposure and response prevention, short-term therapies, brief therapies. Usually we would try and define the problem of the patient, then set a target of time, and then pick up principles from these other therapies and try and offer a solution to the patient.